Welcome to our today's episode of Health Talk.
When I talk about the sleep disorders, there are so many, but I'll major on 5, which are very common.
It is good because it is during the sleep when the body renews its strength.
If your sleep is altered during those hours, especially in this time of COVID, anxiety being part of it, instead of the body going into rest, it will produce hormones that will keep you alert.
Other people, they say that they are very scared in dreams and they are scared when it comes to sleep.
Exercising few minutes prior to going to bed, you've made your body very alert. You can't go automatically to sleep as you're supposed to do.
Every time monitor your sleep pattern. If it is altered, kindly seek healthcare attention. Hello viewer, welcome to today's episode of Health Talk. Today we are discussing about fibroids, and my name is Lucy Wanzakariuki. I am your host for the show. You can talk to us as we continue through our SMS line, which is 21144, or through our Facebook channel, Facebook page, which is GBS TV Africa, our YouTube channel, which is GBS TV Africa. Today in the house we have a special guest who is going to help us to unfold and discuss fibroids. Welcome to the show. Kindly introduce yourself.
Thank you, Lucy. I'm Riziki Zainabu. I'm a clinical officer from Mwala Level 4. I'm a specialist in reproductive health. Mwala Level 4 is in Machakos County.
Welcome to the show, Riziki.
Thank you.
So for today, kindly tell us about fibroids. Introduce.
Okay. Thank you. Fibroids, as the name says or suggests, it's a fibrous tissue. Fibroids. It's a fibrous tissue of the uterus of a woman, or it's called a myoma. Myoma meaning it affects the muscle layers of the uterus. It's benign. It's benign meaning it's not cancerous.
Yes.
So it's a growth or a tumor of the uterus that is not cancerous. It's just benign in reproductive age women.
Okay, so you are talking about the uterus, which is the female reproductive organ.
Yes.
That is where the baby grows.
Yes.
So are there types of fibroids?
Yes, there are types of fibroids depending on the site or location where the fibroids are located.
Okay.
Yes, in the 3 different muscle layers of the uterus.
Yes.
There is the inner layer, then called mucosa, then there is an endometrium, then there is a muscle called seroso. Yes, so it gets its name depending where it's located. Yes, if it's in mucosa, we can say mucosal fibroid. If it's on the outer side, the serosal fibroid. If it's inside, in between, it's a myoma that is inside the inner muscle.
Yes.
Yes.
So you're telling us that fibroids can affect any layer of the uterus. Okay. So the uterus is in layers.
Yes.
How can you describe the uterus to somebody who is watching us and wondering which organ of the body is this called uterus?
Okay.
Yes.
Uterus is a small female reproductive organ. It's placed in between the vagina and the other extreme end is the ovary. So from the ovary to the fallopian tube, then to the uterus, where the baby is implanted after fertilization from the fallopian tubes. So uterus is where the baby is implanted after fertilization. Then the exit is the cervix, then the vagina. So it's in between.
Okay.
Yes.
What are the functions of this uterus you've just described?
Okay. Uterus mainly is it's a womb that carries a pregnancy. And the uterus also is a reproductive organ that produces menses every end of the month for the woman. It sheds the inner layer as menstrual period. It's where implantation happen in the uterus. Yes.
Kindly tell us, how can someone understand or come to a conclusion that this could be fibroids? Signs and symptoms.
Okay. Fibroid most of the time are asymptomatic. They are not problematic.
Problematic.
Yes. It's dependent on the size of the fibroid. They can be very small that they won't be significant and they won't produce any signs and symptoms. They vary in size and location. So the larger the fibroid, definitely it will be problematic. That's when the patient will start having signs, but they won't be leading to fibroids. They might be having a heavy menstrual flow. They might not really know that it was fibroid that was causing. So most of the time it's discovered accidentally. It doesn't come outright with symptoms. Maybe you're going for an antenatal checkup, you're pregnant, then you're sent for an obstetric ultrasound to check the baby status or the gestation of the baby. Then accidentally the fibroid is noted. It can coexist with the pregnancy. Yes, so it's discovered accidentally. But some patients will come with symptoms of fibroids.
So then when is this specific woman going to visit a clinical doctor?
Okay, just like we've said, it's mostly asymptomatic.
Yes.
But sometime when the fibroid are especially located within the endometrium or submucosal region,
yes,
where the shedding of the layers to form period.
Yes.
So when the fibroid is situated at that place, it will interfere with menses. They might be irregular, they might be heavy, severe cramps, or spotting throughout.
Yes.
It will, and if it's so big, it doesn't matter where it's located. If it's so big in size, you will feel pressure and pain around your pelvic region. There will be frequent micturition, going to urinate frequently because the bladder has no space to store urine. So anytime the urine comes in, it is excreted very fast. Or you can have even constipation because of obstruction.
Does it have a specific age of developing?
Yes, fibroid are hormonal related.
Yes.
Theories say that hormones are responsible for formation of fibroids. So during a woman's reproductive age, from 15 to 45, that's when fibroids tend to flare. They are there. They can't come earlier because they can't come earlier in your puberty age because you're developing.
Yes.
That's when you're acquiring hormones. But when your hormones are at the peak, that is the reproductive age, from 15 to 45, then you tend to have fibroids. Past 45 years, you're heading to your menopause. So the estrogen and the progesterone is going down. Yes.
Can a woman who has never conceived be able to get fibroids?
Yes.
Or is there a relationship between childbirth
Yes.
and fibroids?
Yes, a woman who has never conceived, can get fibroids because it's hormonal related.
Yes.
We said it's progesterone or estrogen. That is the hormones that are involved in formation of fibroids. And in pregnancy, they can coexist. During pregnancies, our hormones are high.
Yes.
So we've said the moment the hormones are high, the higher the chances of you having fibroids. So if you had fibroid before conception, when you conceive, they can be bigger in your pregnancy and they can interfere with the pregnancy because they grow bigger because of the hormones.
So what is the largest size that according to your experience?
They range from different sizes to as smallest like a seed, even to as big as a pawpaw or a watermelon, as big as from the pelvic region to your rib cage of the chest. They can feel your whole abdomen.
I heard of a client whose fibroids were able to be like half a basin, you see the medium basin of water.
Yes.
And immediately it was removed, she collapsed.
Okay, yes.
Yes. Because maybe you can explain to us how that happened.
The bigger it is, the higher the blood supply it gets from your system. You even become anemic because it's getting all the supply. It's growing. It's gradually growing. So it will get blood supply, plenty blood supply from and it's around the ovarian artery, the big arteries, they supply the fibroids. So circulation goes to the uterus.
So this is kind of a shock.
Yes. Maybe she went into a shock after the blood supply was suddenly cut, and the blood was used to flowing to somewhere, and you've cut this supply, and the blood vessels were big. They were channeling the blood wherever the fibroid was. So you suddenly cut the blood supply.
Can we attribute any factors to the size of fibroid? Like maybe you could say, due to these reasons, this woman had a pea size of a fibroid, and due to these factors, the other woman had the large basin size. Okay,
they grow differently in different women because of our hormonal levels. Mostly it's because of our hormonal levels. Yes.
What about nutritional factors? Can they contribute?
Okay, nutrition factors. People who tend to take sugary, high starch diets have bigger fibroids because they feed on ready starch that you've already taken, sugary things. That is ready starch. Unlike a person who is a vegetarian or who watches her diet, those people will be very different because the fibroid will depend on the ready sugar.
Wow, this is very good discussion about fibroids. So kindly tell us, what are some of the contributing factors, the causes? Because you've told us that it can affect any race, any age, and any kind, as long as you are a woman. What are some of the causes and contributing factors?
Okay, the causes are not well known, but researches are ongoing. And few factors have been associated with the fibroid growth. Like I've just said, the progesterone and estrogen levels, yes, when they're high, your chances of getting fibroids are there. And also your lifestyle, like you've said, diet, people who smoke, people who take alcohol. Also growth hormone. As we grow, we have a growth hormone that makes us grow. So coincidentally, they cause the overgrowth of an abnormal cell. Yes.
Okay, so which means, what of red meat? I've heard, is it a myth or is it true that red meat, I think red meat is from pig, from a cow, from a goat? Is there a relationship between red meat, especially those women who take a lot of nyama choma on the streets?
Yes.
What can you say about that? Is it a myth or is it a fact?
In general, it's not a myth, and it's according to what causes fibroid. I can't really attribute red meat to fibroid, but yes, eating healthy helps you to reduce your chances of having fibroid. Just like in a general population, you will tell them to take white meat and not red meat, to minimize red meat and take white meat for a healthy, balanced diet.
Okay.
Yes.
You've also talked of pregnancy coexisting with fibroids.
Yes.
Are there women who have delivered safely or women who have died after delivery because of that coexistence?
Okay. Fibroids, they can coexist to term. They really don't have a specific worry. If it's not growing in size, we are not worried. It can coexist with the pregnancy. But if it's growing larger, as the pregnancy goes, it tends to cause abortions in that woman because the fetus has no space to develop. It tends to cause abortions and preterm labors and preterm deliveries because the baby has no space. Yes, but if it's not overgrowing, it can coexist with the pregnancy.
There are women who undergo cesarean section and have fibroids. Do they make it?
Yes,
or accidentally it can be interfered with, also interfering with the life of the mother, threatening even to death.
Yes, depending on the size. The larger they are, the much they consume our blood. You even become anemic. So you're a candidate of transfusion if you're going for CS. And when you do your CS and you've already cut wherever the baby is coming, wherever you're delivering the baby. So that is a wound open and it's bleeding. Then if you decide to remove the fibroid, remember that area is very vascularized.
Yes.
So the moment you interfere with the region, it has many vessels that are supplying the region.
Yes.
So the moment you interfere with the fibroid itself, there will be excessive bleeding because the area was used to high flow of blood. So there will be excessive bleeding.
Suppose
most of the time we tend to leave it.
Yes.
Because after you remove the baby, the fibroid will shrink. So you can't do the two surgeries at the same time. You can't remove the baby and at the same time remove the fibroid because there will be a lot of bleeding.
Okay, so I'm trying to look at it like a mother has been having a CS, and accidentally there is that bleeding. Yes. What is usually done inside theatre?
If you incidentally cut the fibroid, or you decide to remove the fibroid and there is excessive bleeding, you're left with no choice but to remove the uterus if there is excessive bleeding. Yes, or do other surgical maneuvers to try and control the bleeding.
I'm asking like this because I'm just trying to imagine if a surgery is done. You can go ahead now remove the fibroid because it is the one which is bleeding.
Okay.
If it's or the veins that surround the fibroids are the ones which are bleeding excessively. Can we remove particularly the fibroid without removing the whole uterus to spare? Maybe this is a first time mother.
If you're pregnant, if you're going through a CS.
Yes.
Okay.
Because now the abdomen is already open. Yes.
It's dependent. Whether the mother maybe wants to conceive, we want ever to conceive again. The treatment is dependent on future conception. Yes.
Wow. So if it is inevitable, you remove the uterus even without the consent of the mother, because now it's a life.
The mother would have signed earlier. They sign a consent of CS or anything else that we find abnormal, we can remove.
So this consent is permission.
Yes.
That you can, anything can be done on you once the procedure starts.
Yes.
To save your life or the life of the baby.
Yes.
Oh my goodness. It sounds strange because the mother never knew all this, but I hope they are explained before.
Later on, and even the whatever is removed, the tissue is preserved for the mother to see.
Yes. Now that you've been in practice as a reproductive health specialist, I'm sure this is not a new thing. I remember there was a time you were in Kenyatta, so I'm sure there you see a lot of stuff.
Yes.
If I may ask, is there a situation that a mother comes out of theatre?
Yes.
She had gone for CS. And now upon discharge, you are explaining to her that you also left the uterus there. Now you are going home only with this baby or without this baby, and there is no hope in future.
Yes.
Have you ever done? And how was the reaction of the mother, the husband, the family?
So when in such a sensitive case, you will have done the consent prior to operation. And you never knew that there was going to be an emergency intra-op, when you're inside the operating table. So this consent might not really cover you, but yes, you do counseling. If you do counseling prior to any surgery, you explain to the mother, you're going to theatre, and if we get anything that will interfere, will put your life into risk or the life of a baby. I think if you counsel before, even after, it's not hard. But at times maybe we overlook and say that we are going for CS. So we just tell the mother we are going for CS. We'll cut, we'll remove your baby, and later on she has no uterus when leaving the operating room. Yes, it's shocking. But I think also relatives should be involved in such disclosure. Yes.
Okay.
Yes.
Now if I may ask, do you this consent I signed for the cesarean section?
Yes.
Now I do not have a uterus.
Yes.
What are the legalities of the matter that come into place? Because now as a family, we might decide we are going to sue you in a court of law to tell me why that I do not have a uterus. Yes.
Okay, that consent form is quite long. It has everything captured, even transfusion, anesthesia, everything is captured in the form.
Yes.
So you're signing that you're going to theatre for a CS, but other things will be done unto you.
Yes.
You may need transfusion. So if maybe you go to a religion that does not allow transfusion, we read you the consent form and tell you what you are going to do. There will be students and everything. This doctor will do you the CS. So she has to sign. If there is one thing that the patient is disagreeing, she will say, I don't agree with this part. Yes. So it's a very
so you can't
lengthy,
force it.
You can't force it.
So even now in a court of law, you're covered.
Yes.
Wow. Okay. You know, it's good also to understand that the things we sign in hospitals, the procedures that you're told, write your name here, sign here. You're supposed to ask, what am I signing for? What am I writing my name for? Why am I giving my ID number? So that afterwards it is easier to understand and also to explain. That is so encouraging that our clients get a lot of health education. But if I may ask, on the ground, is this information given? I'm looking at a sub-county hospital or a county hospital whereby the CSS or the emergency list is too long. There is the problem of shortage. How do you go about this?
Okay. Yes,
how do you reach to each patient?
Yes, issue of shortage is there. You might be having few, let's say a medical officer is one, like in our facility, CRH is one, and you have 6 patients to take to theatre.
Yes.
So we just have to work as a teamwork. Yes, we don't have, and we have nurses, so the 3 of us can divide.
Yes.
Maybe daktari takes the first patient and takes the consent. As daktari continues, I can take the other patient and explain. As this patient goes, the nurse can take another one and explain. So teamwork helps when there is challenge.
So in simple terms, you're saying that whether there is no enough workforce, that one is not a reason whatsoever to neglect a very important or even the minor procedure that is done to a patient.
True.
Thank you so much, Riziki. I understand that we are doing a lot of work in our facilities.
True.
And fibroids is a concern, especially to many women. Because the aged women think fibroids are for the young. The young think fibroids are for the aged. I don't know how you people handle this dilemma, because I want to imagine a Form 4 student or just a newly married couple with diagnosis of fibroids. How do you handle
Yes, it's a challenge in our society. Like I had just said, they happen or they occur in reproductive age. That does not mean they don't occur post-menopausal menopausal age. Because if you had a fibroid in your reproductive age that never regressed, you carry it to the menopausal stage. When you go to menopause, they are supposed to shrink. But if they don't, that's when now we intervene and treat. Yes.
So regardless of age, it can still occur.
Yes.
Okay, thank you so much. We are watching Health Talk Show in GBS TV. You can continue talking to us on our SMS line, which is 21144. Facebook page is GBS TV Africa, and our YouTube channel is GBS TV Africa. Now we are going to discuss about the diagnosis, how one can be able to know that she as fibroids. But before then, Riziki, we have myths and misconceptions surrounding fibroids. We've heard about family planning, that it may cause or it is a contributing factor. We do not know. You are here to clarify to us about genetics, that if a particular family, one person has fibroids, all the women in that family will suffer from fibroids. Can you highlight on that as you go to diagnosis?
Okay, thank you, Lucy.
Yes.
Yes, I want to start with genetics. It's true. Genetically, most health conditions are genetically transmitted or genetically predisposes you to that condition.
Yes.
So yes, genetic is among the predisposing factors of fibroid. That if one of your mother had them, that it can go down the family line. So it's true. About family planning, we've said the progesterone and estrogen are the victimized or are the causative sex hormones that cause fibroid proliferation.
Yes.
So, but when we come to look at family planning, the dosage in these tablets and this injection and implant, it's standardized.
Yes.
Unless if you're using the herbal that we really don't know the standardization. So there is less chances. I'm not saying 100% that they will prevent you from fibroid, but I think they are standardized and accepted dosage for those family planning. Yes.
Okay, so you're trying to tell us that family planning, it's a myth to say that it causes fibroids.
Yes.
It's a myth. It's not a myth to say that in some families,
yes.
Once one person has fibroids, there's a possibility others can get.
That is not a myth.
Kindly take us through the diagnostic procedures. What is usually done to this patient to be given a report that now we see, we realize that you have fibroids, and does it have staging?
Okay.
Yes.
Okay, thank you. We've said fibroids are most of the time asymptomatic, but they can present with symptoms mostly from other organs of the body or system, not necessarily reproductive system, like frequent micturition and pressure or pain around your pelvic region. And you can also have excessive PV bleeding or cramps, severe cramps during your menstrual period. So if we've ruled out anything else like pregnancy, we need to know what is causing this.
Yes.
Heavy bleeding. If you're not using family planning, you're not pregnant. So mostly it's through examination. You can do hand examination when you're doing your general examination of the patient. You can feel an abdominal mass. It won't lead you or tell you it's a fibroid, but that is one of a way of identifying a mass around your pelvic region. So ultrasound, we say they are golden. They are the best diagnostic image that you can do. Ultrasound, pelvic ultrasound, also obstetric ultrasound. They show fibroids when you're pregnant. So mostly they are ultrasound and MRI. They are MRI, ultrasound, things like hysterosalpingography. They are all imagery. They are the best. They can give you best results because they will show you where the fibroid is.
Yes.
They will show you the size and the shape.
Yes.
Yes.
We've had and we've seen women who get a lot of pain during their periods.
Yes.
During their monthly periods. In fact, the pains can start as early as 48 hours before the onset of the periods and proceed maybe even days after. How can we relate that with fibroids?
That is
and
true.
how painful is painful?
Painful, like you're not able to stand.
Yes.
You're not able to walk. You have to be on painkiller so that you relieve this pain. Yes, painful menstruation, we've said it's a sign and symptom, but there are so many other causes that can cause painful periods, especially in young adolescent girls. But we don't expect that pain in a mother who is a paras, who has delivered. We don't expect that pain. But for young ones, yes, we expect the pain, but not severe pain. Mild to moderate, it's okay when they're having their periods. But severe cramps that can show you there is a pathology behind it. Is a fibroids? Is it something like a hymen that is not perforated? There is something we call adenomyosis. There are so many other causes of painful menses, but you don't expect that severe pain in mothers who have already delivered.
So you're trying to tell us that the uterus can suffer from many other conditions apart from fibroids, which can also cause the bleeding and which can also cause the pain. Now, looking at this pain, how I am sure many women encounter that painful periods. Girls have been stigmatized by others, given a lot of myths and misconceptions. What kind of painkillers or analgesics are you going to advise them to use, and where can they get them?
Okay, NSAIDs are good. NSAIDs, I mean, they are a group of drugs called NSAIDs, things like brufen, mefenamic
What
acid.
do you mean by NSAIDs?
Non-inflammatory drugs. It's a group of drugs. So amongst them there is brufen.
Non-steroidal.
Yes, non-steroidal. Yes. They are non-inflammatory and non-steroidal. They are not steroids, so they are safe. They don't contain steroids. So yes, you can use brufen.
An example.
Yes, diclofenac, mefenamic acid, meloxicam, such group. And also Buscopan help. Also Buscopan plus. It's a Buscopan maybe plus paracetamol or a brufen. And they help also to control the bleeding. So I would prefer giving an NSAID because it will do too.
Frequency of this treatment, or it will depend on the clinician?
Yes, mostly the pain are during the first day of your period. So if you take for 3 days or 2 days, it's safe.
So you can advise them to start taking like 1 day before?
I would advise them to take the due day, because you're not sure whether you're going to have pains regularly every month. You can take the due day. Yes.
Okay, because I'm just trying to imagine that you're telling me to start immediately the pain starts.
Yes.
And I wanted to block the pain because some of them start with vomiting, fainting.
Yes. Okay, if you have other signs that are leading to your period is coming, you can. But I'm thinking like you're having a mild pain maybe from something else and you've started taking your NSAIDs. Yes, if you're sure it's the time of your period, you can take NSAIDs before.
So now that you have diagnosed, how do you move on from there?
Okay, diagnosis, definitely when we find it's fibroid, it's so management depends on several things. It depends on your age, your parity, and the size of the fibroid, and is it problematic or not. So it's dependent on the symptom and your age. Yes.
So what are some of the management modalities that you people use in the hospital?
Okay, we can use medication to avoid surgery. And when you're using medication, it's because we don't want to do surgery on you. Maybe you haven't, you don't have a child, and you in future you'd want to conceive, because some surgeries will do away with your uterus or weaken your uterus. So there are medication that we can give you, hormonal. We've said it's hormone, so we give you medication to balance your hormones. Once we do that, your fibroid will shrink. Yes, it will shrink, and they will give you a chance maybe to conceive. Yes. Then we have watching. You can just watch and let it disappear on its own, because they do. Like a pregnant woman who is pregnant, the fibroid will be big when pregnant because of the hormones. But once the mother delivers, the fibroid shrinks. So there is no need of taking this mother for surgery. So we can watch. If you're towards your menopause, we can watch, because we know once you're on the other side of your menopause, your fibroid will shrink. So watching over for symptoms to regress. Don't do anything. Use medication that will control your hormones, or do surgeries. Some surgeries are invasive, others are not invasive. Laparoscopically, that is a non-invasive procedure that will get inside your uterus and maybe remove the fibroid from wherever it is laparoscopically. That means you're not being opened. Your abdomen is not being opened. They're using a laparoscopic machine at your umbilical region, and they remove the fibroid. Or they can do surgical, invasive surgery, that they go through inside your abdomen, go to your uterus, and remove the fibroid itself and leave your uterus intact. It's called myomectomy. They just remove the myoma. Or they can do hysterectomy. That means the fibroid is too large. It's occupying most part of your uterus. So there is no need to remove the myoma. We won't save anything. So they can remove the myoma together with your uterus. So we call that hysterectomy. Then we can do abrasion. Abrasion is when the fibroid is in the mucosal region from inside the first layer that they insert laparoscopically too, and they remove, especially those that are pendangulated. You just cut whatever is inside and leave the uterus for future use. Yes. So we have medication, surgery, and you can as well watch and wait and see if they can regress. Yes.
Okay, so in this management, whereby you've talked of watch over, watching, I'm just imagining, how do you tell the clients? How do you ensure that the client really watches over?
Okay, it's also dependent on the symptoms. You can't tell a mother who is severely bleeding to watch until they subside. The mother will be anemic. It's also not comfortable for a mother to be bleeding throughout. So it is dependent on the symptom. Maybe this fibroid, it's not giving much symptom. It's not problematic. So why remove? We can wait for it to regress.
Yes.
Yes. There are also surgeries that you cut the blood supply to the fibroids instead of removing. You just cut the blood supply and the fibroid dies.
Shrinks.
Yes.
Okay, so you're telling us that there is a lot of counseling that is done to this particular client.
Yes.
Because to just tell the client to watch over, they might think that you people are incompetent. You do not know what you're saying.
True.
And in the process, they may end up going maybe for herbalists.
Yes.
Or even seeking healthcare elsewhere because of loss of confidence.
Yes.
Okay, now we want to go to the prevention part of it. I know people want to know, like, how can we prevent ourselves from getting this, and what is the role of diet in it?
Okay.
Yes.
Thank you. Fibroid, we've said they are not contagious. They are not cancerous. They can be inherited. We can't change that. If they are genetically inherited, then we can watch whatever we take inside our body, like diet and medication.
Yes.
You have to be sure what type of medicine you're taking. Will it interfere with your hormones? Is it herbal concoction? You don't know the dosage of the hormones that are in there. So we should be careful. We can't say per se we can prevent fibroid, but at least a health diet, a healthy living, not smoking, not taking alcohol, just living a healthy life and a healthy diet.
What are some of the diets that you would recommend?
Okay.
Yes.
Meaning a healthy diet, it's just you do less starch. We've seen even in cancer patients, they reduce starch because starch or sugary thing like sodas and sweets, they provide ready sugar. So this sugar will make the tumor grow faster. It will be nourished. So I would advise for fruits, vegetables, and less sugary starch.
When we are managing fibroids, our goal is to have a uterus-free fibroids.
Yes.
Because already it has a fibroid.
Yes.
At some point, things may not go as we had planned.
Yes.
What are some of the complications?
Okay.
Either because of the fibroid or because of the treatment, that is the procedure that is done. What are some of the complications?
Complications of fibroid. Once you get fibroids, we've said they consume a lot of our blood. So the patient will have chronic anemia, not knowing what is happening. You'll ask about diet, you'll ask, are you bleeding? They will tell you no. But the fibroid itself is consuming a lot of blood.
Yes.
So this patient will have chronic anemia. This patient will be fainting. This patient will have chronic constipation, chronic pelvic pain. She doesn't know what is happening, no PV discharge, no history of trauma. But the pain is there persistent, and pressure is there persistent. And we've also seen that it will cause early miscarriages, it will cause miscarriages and preterm deliveries. Those are some of the complications that it will cause. treatment modality, there is none that has been shown to be superior than the other. They are all good. It's just depending on your age and your fertility needs in future. So none is superior than the other. But of course, invasive surgery, they'll leave you with scars. Yes.
Do they complicate to cancer, and how do you go about it?
Okay, fibroids are purely benign. Rarely do they go to cancer unless there was something else that was to develop anyway, not because of the fibroid. Unless it was to develop, you had to develop maybe endometrial cancer inside the endometrium,
Yes.
and the fibroid is there. Definitely, it will turn to be cancerous. But as fibroid per se alone won't be cancerous. It won't turn to be cancerous.
So for how long what is the outcome, and for how long does the treatment period take? For example, the medication.
Medication, you'll be giving medication as you watch, as you repeat ultrasounds.
Yes.
So that you know where we are going. Are we, is the fibroid shrinking? What is happening to the fibroid? So really no duration. You can go up to 6 months as you monitor, as you're giving some injections, as you're giving your injections, you're doing repeated ultrasound to see what is happening.
And during this time, is this particular woman trying to conceive?
Yes. Once you deal with the fibroid, but you can't be on medication to shrink your fibroid and at the same time you want to conceive. If you want to conceive, you go for maybe abrasion if the fibroid is inside your endometrium to remove the obstacle so that you're able to conceive. But if it's a long-term treatment, just finish the treatment first, then try to conceive.
So what is the prognosis or the outcome that we expect?
Outcome of fibroids, the outcome is good. Any treatment. It's also dependent on your age. Like very elderly women, we really don't want to take them for surgery because of their age and medication and all the bleeding and all those complications. So it's depend on elderly extreme. We just watch or maybe give treatment orally, but surgery outcome might not be as the outcome of the young, energetic woman.
So are these women conceiving and giving birth?
Yes.
Because the most important function of the uterus is to give birth.
Yes.
So now that they have fibroids, do they give birth?
Yes, they do give birth. And once you discover a mother has an issue, has a fibroid antenatally, the woman starts now going for high risk clinics where they are followed up more closely for signs of preterm labor. So they are delivered early in a hospital that maybe has a newborn unit. So they are delivered early. The mother will be safe and the baby will be safe. We don't wait for preterm labor to happen. We monitor them and remove the baby earlier if it's not able to coexist with the pregnancy. But some carry their pregnancy to term and deliver normally through normal delivery.
So there are people like the husbands and the family members living with a patient or with a woman knowing that she has fibroids. Does it affect them, and is there any counseling done to them?
Okay, if you're living with fibroid, definitely symptoms will be there on and off, the pain and everything. So yes, you have to counsel the husband, you have to counsel whomever, the guardian, whomever they are living with, and explain to them what this patient is undergoing and modality of treatment, the options that are there, so that they help them choose what type of treatment they would prefer. Yes.
So there is counseling for caregivers and family members?
Yes. Yes.
Are they directly involved in the care? Or the care and going to the hospital is purely for the woman?
It's purely for the woman. She's the one who is feeling the pain, experiencing all this nuisance. So yes, and women will always want to give birth. So it will be a concern of a woman to go to seek for medical attention. Yes.
Now, suppose the woman now has just delivered.
Yes.
Fibroids aside, the baby now here. Is this baby having a disability? Because I want to imagine that this was this fibroid anyway? You can tell us. Was it pressing the baby? Was it like the babies play inside? They turn movement. Do they move normally?
Of course.
Are they affected? Maybe the limbs have been in one place for long.
Okay.
Yes.
Okay. They are not born deformed. That is one thing. You will give birth to a normal baby.
Yes.
But yes, there is compression and limited space of movement. The baby is growing. The fibroid is growing. So the baby has an exit. So the baby will leave and leave the fibroid behind. That's why they get the early delivery or preterm. Preterm delivery.
So one complication is preterm baby, preterm labor.
Yes. So the baby leaves.
Is this labor initiated by the fibroid?
Yes, because of the pressure.
Overstretching of the muscles.
Yes.
Okay.
Yes.
Yeah, because I'm just imagining, you talked of family planning. You said that it's not a point of concern very much.
Yes.
And a woman is on who has fibroids.
Yes.
Can they get family planning?
Yes, they can get family planning. And especially the IUD, the hormonal IUD, it's good for them because it will control the heavy bleeding once it's inserted. Because we've said when you have fibroids, the surface area is larger of the uterus. It becomes larger, so you bleed more. So once we insert the IUCD, it's hormonal. It's going to control your heavy bleeding, and it will serve as a family planning method. Yes.
I know there are women watching you right now and who need hope.
Yes.
What would you tell them as you give your parting shot?
Okay.
Face at your camera, then speak to that viewer.
Okay, I'll just want to explain to them that fibroid is not cancerous, nothing to worry about. Women are giving birth. It doesn't matter at what gestation. You're given a chance to conceive, carry your pregnancy, because fibroid rarely interfere with your pregnancy. They will just cause your preterm early delivery, and we have NBUs. Such mothers, once you know you have fibroid, you have to attend to a facility that has everything that you need for the baby and for you. You might need to go to theater. So if you have to go to deliver, make sure even your antenatal clinic, you go to a level 4 or a level 5 hospital and above.
Thank you
so that you're followed up.
Wow, thank you so much, Riziki. It was such great pleasure hosting you in this show. We have learned a lot in women health, whereby we were discussing about fibroids. And I would like to tell women there, it is always good to go for medical checkup. If you have any of those signs, you have bleeding, you have incomplete emptying of your bladder, if you have pains that are persistent, painful periods, it is always good to be checked by a gynecologist so as to rule out fibroids. It is treatable, it is manageable. You can be able to give birth to normal babies, you can live a normal life. You have been with us here in HealthTalk Show, whereby we educate, we update, and we promote health. My name is Lucy Wanza Kariuki, and bye-bye till next time.